So, I asked a question in the previous story about why certain cavities feel more sensitive to patients and when you should expect your patients to have pain or sensitivity or discomfort when you're drilling. It revolves around the theories of sensitivity that we study for tooth sensitivities, right? So there is a theory where there is a nerve which is all the way up into the in the dentinal tubule and comes all the way till the dentinoenamel junctions. Anatomically speaking, from an oral biology perspective, that's true. It happens. There are 20% of the dentinal tubules which contain nerve endings. So that's the reason why when you're drilling and if you're going through the enamel and as you come close to the dentino-enamel junction, your tooth starts feeling sensitive. So shallow cavities and cavities which have a healthier dentine will show more sensitivity compared to deeper cavities because the deeper cavities actually have dentinal tubules being blocked, sclerosed, tertiary dentine formation, and that's the reason why when you're drilling and you're close to the dentino-enamel junction in a shallow cavity, it could be the nerve ending, it could be the hydrodynamic theory, and it could also be the odontoblastic theory. And these three reasons are why teeth feel more sensitive in very shallow cavities. But when you have a deeper cavity and when you cross the dentino-enamel junction, in most cases, if there is a deeper lesion and if it's a long-standing lesion, the tooth actually will repair itself in a way where you will be able to see that the patient experiences minimal to no sensitivity because the dentinal tubules are either sclerosed, they're either blocked, or there is tertiary dentine formation which desensitizes that part of the tooth. Here you can see the histological cross-sectional view. We've all seen this in our undergrad years, and this is the dentino-enamel junction and how you can see the dentinal tubules come in and open. And this is the areas where exposure can lead to sensitivity. This is how it changes when you're doing when the cavity invades. You can see at the bottom right here that the dentinal tubule architecture has actually changed because of the invading cavity right on top. You can see in the triangle. So the invading cavity has reached the dentino-enamel junction, and from there the changes in the dentinal tubules are because of the invading bacteria, but these black spots are where the sclerosis and the blockage starts to happen. And this here is the pulp. So this is how the dentinal tubule changes and blockages and tertiary dentine formation actually leads to protect the tooth from sensitivity. My final picture today is to make not just dentists but the public realize that the cavity starts small, but as it invades even the small bit of cavity which is between your tooth, which shows as a small, very small black spot on the x-ray, can lead to very big consequences for the tooth. This is not caught on time. This can lead to a cavity invading all the way towards the pulp, leading not just a small filling but a root canal, or in some cases even the tooth might not be able to save if there is a crack, or if the tooth structure gets weaker, if the filling goes much deeper below the gum level. So there are a lot of things that can happen. So let's understand this one basic thing. The smaller the cavity, the more easier it is to fill, the more long lasting the tooth will be, the better chances for the tooth to have a longer life, as the tooth is vital. You don't want root canals, it's a necessity. There's nothing wrong with the root canal, but it's for the long term success of your teeth, you want them to stay alive. And that's something you can only do when you go for 6 monthly checkups. Listen to your dentist when they tell you there's a small or mid-sized cavity. Ask them for an x-ray. Try to look at that x-ray and try to find out where those black spots are. So when you look at an x-ray, and this last segment is not just for dentists, it's for patients. So when you look at an x-ray, I want you to remember that anything which is white is good and anything which is dark or black or shadowy is definitely not good. And that's something when your dentist tells you that there is a cavity, look for these signs, try to understand, ask them in a non-threatening way about where do we see the cavity, what does it look like. I have so many patients who tell me, Dr. Saab, this is not our job, हमें तो समझ नहीं आता जो आपको लग रहा है वो सही है. But as patients, be informed, try to be inquisitive, because you don't want your dentist telling you you have 12 cavities when you in fact just have 3, right? So there are a lot of times there are going to be dentists who are going to be very honest about their work, but there are also going to be people who are going to be dishonest and are going to try to overtreat you. So in that situation, it is your responsibility as a patient to look at what's going on and try to understand in a very non-threatening way. Ask your doctor about what they see and ask them to show you, not convince you, but to show you about what they see, and then you can make a conscious decision. Thank you very much.